My name is Philip Moos. I'm Professor of Healthcare and Nursing Science at the KU Leuven Department of Public Health and Primary Care. I hold a joint appointment as researcher and scientific leader at the Institute of Health and Care Sciences of the University of Gothenburg in Sweden, and I'm an honorary professor at the Department of Paediatrics and Child Health of the University of Cape Town, South Africa. Currently, I'm the editor-in-chief of the European Journal of Cardiovascular Nursing. The spearhead of my research is transition and care. This research line comprises three themes: research on patients who are transitioning from one life phase, medical condition or social role to another. Research on patients in whom care is transferred from one setting to another. And third, research on healthcare delivery models that are in transition to be adapted for the future needs of patients and populations. The target populations are persons with chronic diseases, healthcare professionals and policymakers. My ambition in the research that I'm doing is to conduct research that provides strong evidence and as such can shape clinical guidelines at an international level. Intervention studies are key in this respect. Further, I want to test and adopt innovative research methods. Certain novel research questions require novel research approaches. This is the reason why we started with a methods corner in the European Journal of Cardiovascular Nursing. And finally, I take science communication very serious. Findings and insights from research should not stay within the research community. No, we need to reach out and make sure that we bring it to the wider society. In this respect, I particularly give a lot of attention to data visualization. One example of the impact of my research is on transitional care for adolescents with chronic conditions. Together with my colleagues of the Healthcare Transition Research Group in Sweden, we developed a comprehensive transition program to assist young people with chronic conditions to evolve from being a dependent child with a medical condition to an independent adult who is able to be the manager of their own health. Using randomized controlled trials, we found that this transition program is effective, and as such, it is impacting on international guidelines, because intervention has now the highest level of evidence and the highest class of recommendation. As a consequence, in Sweden, the transition program is now rolled out in a large-scale implementation science project. Two fascinating projects are ongoing. One pertains to the investigation of accelerated aging in people with congenital heart disease. We see age-related problems occurring more often and at an earlier age in this patient population. In this project, we have brought cardiologists, geneticists and healthcare researchers together to investigate if there is indeed an accelerated aging based on novel biomarkers, and we want to see which clinical, psychological, social and behavioral factors play a role in this aging process. Another study is where we are developing an artificial intelligence system that is able to identify palliative care needs in people with heart diseases. If we can automate the screening, we can better see which patients would benefit from palliative care. Currently, we are developing and validating the system, but we have funding to implement it later on and test if the implementation in clinical practice would yield better outcomes. These projects will certainly impact on clinical care and have the potential to improve patient outcomes in a sustainable way.